Good afternoon. We have just finished our morning session of bargaining and we have some updates for you. My name is Jonathan Argento. I am a critical care nurse. I work in the float pool as Sharp and travel to all 4 hospitals in the San Diego area. So one of the reasons that we are continuing to negotiate is related to our grievance and arbitration language. We want to have the ability, as the bedside nurses that know our patients best, to take issues that are related to our daily work, issues that relate to patient safety, and to bring those to management. We, of course, want to resolve those issues at that level. However, we recognize that there are situations where that cannot happen, and we want the ability to, at that point, raise those issues to an independent party in arbitration. Management's stance is that they will have the last and final say. We don't think that that's in the best interest of the bedside nurses. We don't think it's in the best interest of the patient or the community. So we have much work to do with grievance and arbitration. Nieysha?
Hi, I am Nieysha Richard, and I am a RN on MIS at Sharp Mary Birch for just over 18 years. And we were bargaining wages. And as you all know, we have been a little bit far apart with Sharp on our wage scale. Today, they came with what they call their last, best, and final offer, which keeps us on that banded wage structure that we all decided that we do not want. They keep us at the exact same numbers. The one of 2 things that they did was add a 4th year, which is good for both of us. That's good for both of us because we have added a year of labor peace. But that percentage on that 4th year is only 3.5, which keeps us well below market value. The change to the banded wage structure does not happen until you are a 30-year nurse, and it goes from the band on 30 years to 35 years, and that's it. Nothing else changes. Sharp also decided to let us know how much money it would cost them for us to go on strike, kind of scolding us like children. And we just want to let you know, we know the consequences of a strike. We know how serious this is. We're fighting so that we can maintain our nursing staff, we can maintain our lifestyle here so that we can keep up with the largest hospitals in the county. And we understand we're not children.
Hello, my name is Danielle Begley. I am an 18-year nurse. I currently work at Sharp Memorial on the spa or the pre-op area. And I'm giving an update today on the counter proposal that we heard from Sharp in regards to ESI. So Sharp is still holding on to front loading only 70 hours for both full-time and part-time. And they currently are proposing still leaving per diem out on that language. And they do not want to front load anything for per diems. They only want to have the per diems continue with the 1 to 30 year pool that we all have right now. The one agreement that they did make is to remove language that allows them to unilaterally make changes to our ESI policy, which is what allowed them to make the change before, when they took away the 40 of self and 40 of family that we had previously.
Hi, I'm Peggy Bowman. I have been with Sharp Healthcare for 35 years. I work in maternal infant services as a registered nurse advanced clinician, and I am an international board lactation consultant. I'm here to speak on behalf as a senior nurse for Sharp's core medical retiree health care proposal. We continue to serve at Sharp Healthcare to help them be the best healthcare system in the universe, and they continue to strive to take away medical from us. They have adjusted their age and their RHRA numbers. However, they continue to not want to allow us until Medicare age. They continue to take away the option for us to even keep their own health insurance that they provide to the community. We are part of the community as well, and sometimes even patients. So because, as you recently heard from all of my peers, there are things that we still need to work at. We are headed for strike territory starting next Wednesday, November 26th, starting at 7 a.m. We'd like to see everybody out on the line, and it's time for us to show Sharp a strengths giving. We look forward. Don't hesitate to reach out to any of us to support the team and continue to attend negotiations today and tomorrow. We are here to negotiate in good faith, despite the threats that Sharp proposes at the table. We look forward to see you next Wednesday at 7 a.m. Yes.